What are the types and causes of hypothyroidism and how can we diagnose and treat it? Hypothyroidism Part 2. Hi everybody, welcome to the Lancet Summary YouTube channel. In the previous session, we spoke a little about thyroid gland, its role, hypothyroidism, its clinical manifestations, and the people who are more vulnerable to get the disease. Now I would like to say that thyroid gland is related to two other glands. The first one is hypothalamus and the second one is hypophysis. Hypothalamus secretes a specific hormone called thyrotropin releasing hormone. It regulates and controls hypophysis, and interestingly, hypophysis secretes another hormone called thyroid-stimulating hormone, and it regulates and controls thyroid gland. So we can categorize hypothyroidism into four different groups. First, primary hypothyroidism due to inadequate production of thyroid hormones in thyroid gland. Secondary hypothyroidism due to hypophysis problems. Tertiary hypothyroidism due to hypothalamic disturbances, and peripheral hypothyroidism to some medications consumptions or genetic mutations. Of course, more than 99% of hypothyroidism are primary hypothyroidisms, and the most frequent type of the disease is a kind of a specific thyroiditis named Hashimoto thyroiditis. This disease increased in recent years due to unknown causes. Some scientists believe that the increase is related to some genetic and environmental factors. And a little about the diagnosis of the disease. We can diagnose the disease through measuring two specific hormones, thyroid-stimulating hormone or TSH and free thyroxine hormone or FT4. In normal situation, when thyroid has a little problem, FT4 decreases and then hypophysis senses it and it secretes TSH, and then TSH can regulate thyroid gland and the level of FT4 can come back to the normal situation. But in subclinical cases, we have some problems in thyroid and the function of thyroid decreases. So in the next step, FT4 decreases and hypophysis senses it, and then TSH can increase and it can compensate the situation but not completely. In overt disease, when thyroid have some problems, FT4 again can decrease and hypophysis senses it, and again TSH can increase. However, in this situation, TSH are not able to compensate the situation. So in the last situation, central hypothyroidism, that we have secondary or tertiary hypothyroidism, there is no thyrotropin releasing hormone or thyroid stimulating hormone. As a result, in normal situation, we have normal TSH and normal FT4. In subclinical situations, we have higher TSH and normal FT4. In overt disease, we have higher TSH and lower FT4. And in central hypothyroidism, we have lower TSH and lower FT4. The treatment of the disease is mainly related to using Levothyroxine. It's a kind of medicine which acts like thyroid hormones. Of course, it's a special subject and out of the scope of our channel, so I don't explain more about the different types and different situations in treatment of hypothyroidism. Thank you so much for watching us. The goal of this channel is to summarize a recently published paper from the Lancet family journals. Don't forget to like this video, subscribe to the channel, and leave your comments below.